Hi friends, I'm Annie, your friendly health coach. Welcome back to my page. Today's video is about hepatitis B. Wait a minute, did you know that hepatitis B can be transmitted through contact with infected bodily fluids such as blood, saliva, vaginal fluid, and semen? It can also be transmitted from a mother to the child. Please listen carefully. Although the virus can be present in saliva, hepatitis B isn't transmitted by kissing, sneezing, coughing, sharing utensils, hugging, sharing food, or even water. Hepatitis B is an infection of the liver caused by the hepatitis B virus. In most people, hepatitis B is short term, also known as acute, and lasts less than 6 months. In others, however, the infection becomes chronic. It lasts longer than 6 months. Chronic hepatitis B increases the risk of developing liver failure, liver cancer, or cirrhosis, a condition that permanently scars the liver. Most adults with hepatitis B recover completely, even if their symptoms are severe. Infants and children are more likely to develop a long-lasting hepatitis B infection. This is known as a chronic infection. A vaccine can prevent hepatitis B, but there is no cure if you have the condition. Let me explain. There is no specific treatment for acute hepatitis B. Chronic hepatitis B can be treated with medication, but it is not curable. If you are infected, you can take certain precautions to prevent spreading the virus to others. The hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause an infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the hepatitis B virus is between 30 and 180 days. The virus can be detected within 30 to 60 days of infection and can persist and develop into chronic hepatitis B, especially if transmitted in infancy or childhood. Let us now look at the symptoms of hepatitis B virus. Most people have no symptoms when they are newly infected. Some people suffer from an acute illness with symptoms that last for several weeks. Signs and symptoms of hepatitis B virus include pain in your abdomen, your urine will be dark in color, you will have fever, you have joint pain, you will experience loss of appetite, nausea and vomiting, yellowing of your skin and eyes. Join this. You will feel very tired. In severe cases, acute hepatitis can lead to liver failure, which can result in death. Although most people recover from the acute illness, some people with chronic hepatitis B develop progressive liver disease and complications such as cirrhosis and liver cancer. These diseases can be very fatal. Now that I've explained the symptoms, you may be wondering what causes hepatitis B. You get hepatitis B through contact with blood, saliva, semen, or other bodily fluids of a person infected with hepatitis B, as I mentioned in my introduction. Someone with hepatitis B can transmit the disease even if they do not feel sick. The most common ways this can happen are sharing needles, syringes or drug injection equipment, sharing toothbrushes, razors, or medical equipment such as glucose monitors, direct contact with the blood or open sores of a person who is infected, sexual contact with a person who is infected, contact with blood from needle sticks or sharp instruments used by a person who is infected, being in a healthcare facility that doesn't control infections well. The other one is from the birthing parent to an infant during pregnancy and delivery. So who is at risk for hepatitis B? Anyone can get hepatitis B, but the risk is higher in infants born to mothers who have hepatitis B. People who inject drugs or share needles, syringes, and other types of drug equipment. Sex partners of people with hepatitis B. Men who have sex with men. People who live with someone who has hepatitis B, especially if they use the same razor, toothbrush, or nail clippers. Healthcare and public safety workers who are exposed to blood or on the job. Hemodialysis patients, people who have lived in or traveled often to parts of the world where hepatitis B is common. If you have diabetes, hepatitis C, or HIV. Now that I have mentioned the symptoms, causes, and risk factors, I would like to give you some good tips on how you can reduce the risk of contracting or spreading the hepatitis B virus. Number one, Practice safe sex by using condoms and reducing the number of sexual partners. Number 2, avoid sharing needles or other paraphernalia used for injecting drugs, piercings, or tattoos. Number 3, wash your hands thoroughly with soap and water after coming into contact with blood, body fluids, or contaminated surfaces. Number 4, get vaccinated against hepatitis B if you work in healthcare. And my last tip, hepatitis B is preventable through vaccination. All babies should receive hepatitis B vaccine as soon as possible after birth. The vaccine protects against hepatitis B for at least 20 years or probably for life. Hepatitis B can be transmitted from mother to child. This can be prevented by taking antiviral medication in addition to the vaccine to prevent transmission. Always remember to consult your doctor first if you have any health concerns, and don't forget to take good care of yourself. If you have any questions or comments, please leave them below. If you enjoyed this video, please remember to follow my page and share it with your friends. Thank you, and hey, bye.